Welcome to the fourth module in this mini course on community-engaged implementation science. Today we'll be talking about collaborative implementation planning. Our goals for this module are to go over implementation mapping and then highlight some of the many implementation strategies available. So first, let's talk about the implementation mapping process. This is a process developed by Dr. Maria Fernandez for proactively and purposefully choosing implementation strategies. It's also supposed to be an iterative process, so while we'll talk about the steps in order, in practice you would circle back to make sure that all the key stakeholders and the determinants that you identify along the way are addressed by the strategies you select. The tasks are: 1. Conduct an implementation needs assessment and identify program adopters and implementers. 2. State adoption and implementation outcomes, performance objectives, and identify determinants. 3. Choose theoretical methods and select or design implementation strategies. 4. Produce implementation protocols and materials. And 5. Evaluate implementation outcomes. These are the 5 steps of implementation mapping. We'll focus on the first 3 today and further address the evaluation component in a later module. In the first stage, you're conducting a needs assessment in order to identify the barriers and facilitators to implementation. To do this, you need to include the program adopters, who are the ones making the decision whether or not to adopt a program, and who can also help provide the resources to support the program, and the implementers, who will be the ones actually putting the program into practice. For example, clinic administrators could decide an evidence-based program should be adopted and could help budget and assign staffing to do it, but the providers and staff would be the people actually implementing the interventions with patients. This step is a key opportunity for stakeholder engagement and lines up with community-based participatory research principles. When considering the interventions that will directly involve patients, it's important to also get their perspective on the acceptability of the intervention at this stage. In the next stage, you identify what adoption and implementation outcomes you'd like to achieve, and then you get more granular, identifying the performance objectives, which clearly define who has to do what for each of the outcomes to be achieved, and the determinants for each of those objectives. So what has to be in place for the objectives to be achieved, which could include implementers, attitude toward the practice, or specific skills that they need. In the third stage, you choose higher level methods and then more specific strategies to operationalize these methods. Again, as this is supposed to be an iterative process, these strategies should help address the barriers and facilitators to implementation that you have identified in the previous steps. Now we're going to go into a little more detail on implementation strategy selection. There are many implementation strategies available. In a key paper in 2015, Dr. Byron Powell presented 73 potential strategies identified by experts through multiple rounds of review. In a 2019 paper based on experiences from the Evidence Now study, Dr. Cynthia Perry grouped the strategies into 4 general categories for interventions within health systems. 1. Build health information technology to support data-informed quality improvement. 2. Build quality improvement capacity and improve outcomes. 3. Enhance clinician and practice member knowledge. And 4. Build community connections and patient involvement. Given this course is focused on community engagement, we'll look at some of the implementation strategies within this last category. In Perry's research, the different teams tried a number of different strategies in order to access new resources and tailor interventions to improve patient adherence. These included engaging community resources, developing resource sharing agreements with local organizations, involving patients and their family members on the research teams, obtaining and using feedback from patients and their families, and preparing patients to be active participants in the intervention. Now let's take a look at some of the strategies used in the actual study. We'll go over the scenario together, and then you'll pause and take a second to consider what strategies you might have used. Evidence Now, a project funded by the Agency for Healthcare Research and Quality, was focused on the rapid dissemination and implementation of preventative care for heart health in small primary care practices across 7 regions. What are some implementation strategies researchers could use that would also encourage patient and community engagement? Pause and consider your answer. Researchers across the different sites used a variety of strategies. They built relationships with community organizations and local departments of health and embedded referrals and resources from them in their own systems. They collaborated with these organizations on joint projects to increase their reach. They included patients by having them participate on the research teams. They had community members help tailor messaging and marketing to their own communities, and they got patient and family feedback in a number of different ways, including surveys, interviews, and including them on advisory boards. This ends our fourth module on collaborative implementation planning. Our next module will touch on evaluating implementation success.